Allergies have been a growing problem in the United States, and right now about 2% of kids in the country suffer from some kind of allergy to peanuts. That number is thought to be growing. Serious allergies to peanuts can lead to anaphylaxis, and that is a medical term for severe allergic reaction, which can actually turn deadly. Among other symptoms, it can make your throat close up, making it difficult or impossible to breathe. This week, new guidelines are out, and there's a new technique that could help doctors get ahead of that problem. So joining us to explain what that could mean for you and your kids, Dr. Sunil Joshi. Thank you so much, doctor, for coming on. This is a big concern because we were just saying there's nuts in everything, basically.
Oh, absolutely. And in most foods, that if you go to a restaurant, you have to ask a lot of questions if you have a peanut allergy, just to make sure you or your child is not at risk of developing a reaction right then and there in the restaurant. 2% of the children in this country have peanut allergy.
So how do we get ahead of that problem?
So, I mean, you know, for years, we used to give bad advice to parents who are concerned about their child developing a peanut allergy. We would say avoid peanuts until your child is at least 3 years of age. And we've learned through the years that that was wrong. And actually, what we really think should be occurring is the child should be exposed to peanuts at an early age so that their immune system recognizes it as being normal and not abnormal.
So how do you start exposing? Would that be like a little bit of peanut butter? I mean, because you do, I know parents out there that want to be careful because they're thinking, well, what if my child is allergic? I don't want to give them like a whole thing and then they...
Absolutely. And so it definitely needs to be done with the guidance of a physician and at times with an allergist in particular. So children who have pretty severe eczema, which is that dry, itchy, red skin that babies get, and or an egg allergy are at very high risk of developing a peanut allergy. And these children, before they introduce peanuts, should be tested for the peanut itself, and then if negative, introduced in a physician's office. Children who have very mild eczema also should see a specialist or a physician in general before they introduce peanuts, but that should usually be done about 6 months of age. And if you have no family history, don't have eczema, don't have any other food allergies, you can introduce peanuts to your child whenever you want to, basically. That's what the guidelines are saying.
For people who do have a child out there with a peanut allergy, are there ways to, you can't get rid of it, right? Once you're allergic, you're...
Well, that's a good question, too. So there are studies looking at ways to desensitize people to food allergies, and in particular to peanuts. And there are studies going on right now that show some promise. The only problem in most of these studies is it doesn't mean, even if you're being desensitized to peanut, it doesn't mean that the child can eat as many peanuts or as much peanut butter as they would like. And number two, during the process of introducing small amounts of peanuts to these children, 25% of them are developing anaphylaxis. And so the risk during the study is greater than the risk of avoiding the peanut itself. And so right now, there are some studies looking at other ways to desensitize that might be safer. But at this moment, there is nothing that the FDA has approved for that.
And I asked you already off camera, but for women that are pregnant, if they eat peanuts, does that help or it really doesn't?
Good question. So, you know, a lot of pregnant women will come to us and say, hey, I don't want my child to have a food allergy. What do I do? And really, the studies suggest that there is nothing that you can do at that point. Whether you are eating peanuts in your diet or not eating peanuts in your diet, the risk for that child is going to remain the same. So just live your life during pregnancy, stay healthy, and deliver a healthy baby, and then we'll go from there.
All right. Well, thank you so much for coming on the show,
My pleasure.
Doc. And if you missed any of Dr. Joshi's advice, we will be posting this whole interview on the morning show page of news4jax.com later this morning. We've also included the link to the original report. Just look under the morning show links.